Welcome back. Pediatricians help treat several different illnesses in kids, but they say that one of the most common issues they hear about, stomach pains. So Dr. Theresa Horton with Utica Park Clinic is here to talk to us about the tummy pains that our kiddos get and then what parents can do to help. And so thank you for coming in, first of all, Dr. Horton. We always appreciate your time. Let's talk about kind of why kiddos' stomachs hurt. What causes all the tummy troubles usually?
It is one of the most common complaints that we see in pediatrics, and the causes can be extremely wide and varied, and that's probably why it is a common complaint. For little ones who don't have a lot of words, anything that they don't like the feeling of can be hurt. So they could be hungry, or they could need to have a bowel movement, or they just may not want to do what you want them to do, and that can be said as hurt. So for older kids, it can be anxiety. Constipation is by far the #1 cause for abdominal pain. And it's rarely ever serious, but it is important for parents to have things checked out if the complaints are frequent or if they become more severe.
I was going to say, when does a parent make that call between, okay, we need to go to the doctor or the hospital?
So one of the things I like to say in the office is if it's interfering with things they really like to do, then we probably ought to see them in the office. If it's only interfering with them eating their vegetables or cleaning their room, then it's probably you can watch it at home a little longer.
Yes.
If the pain is intense and doubling them over, if there's vomiting or fever involved, bloody diarrhea, of course, is a big one. One of the things that's helpful for parents is if the pain is in the center, around the belly button, it's a little less concerning. If it's specifically in one of the corners, then it's more concerning. And right lower corner is one of our concerns for looking at appendicitis, and that would be something you'd want to have seen right away.
That's interesting. I didn't know that. So if it's in the middle, it's not as concerning, but the sides...
The sides are, especially in the corners, we get a little more interested that there may be something more going on than just I don't feel good. So.
Yeah. And so we've already kind of touched on this, but you know, why do so many kids deal with this as they grow up? Just a lot of different...
It is a very good question, and I'm not sure we have a specific answer, but I think it's mostly because there are so many different things that can present as abdominal pain. Because it can be emotional reaction, it can be hunger, it can be just I need to pass a bowel movement. Constipation is very, very common in kids, and more so these days because of a low fiber or high processed food diet. Anxiety is a very common reason for abdominal pain, and we're having a lot more of that in the last few years, especially with coronavirus. So we're dealing with a lot more children with anxiety, and that will present, and sometimes with not only severe abdominal pain, but with nausea, vomiting, and diarrhea.
Oh, that's interesting. So you would think that that comes with medical issues, but it can.
It can also be related to emotional as well.
Yeah.
So if parents are concerned and they want to come see their doctor, I think it's better to come and be checked out 10 or 100 times and have everything be okay than to miss something that's more severe.
Absolutely.
It's also good for them to look at things like what does it make it better, what makes it worse. Those are helpful information to bring to the doctor.
Well, thank you so much, Dr. Horton, for joining us today. Always great information, and we will see her next month.
Thank you, Stacia.